Hello, I'm Dr. Robert Hardesty, a board-certified plastic surgeon working here in Riverside, California. Today I'd like to talk to you about options in abdominal contouring. Well, we're going to go into detail in future vlogs on each of these. I want to give an overview today to tell you about what your options are. We'll separate them into three areas: non-invasive, minimally invasive, and short scar surgery. So let's start with non-invasive. Non-invasive is a procedure that can be done without any pokes or stings. That's done here in the office. It can be a procedure that you get up and come to the office to have the procedure done, and then you leave the office that same time without any drugs or medication. Now, to dissolve the fat without pain. CoolSculpt is a very good procedure to have done. However, we tried that here in our office and we did not like that because of the pain and the numbness that occurs. So we moved on to what we call UltraShape, and now even to the UltraShape Plus, that's been used many years in Europe and has now been used here in the United States. The mechanism is that the ultrasound goes through the body into the fat cells, disrupts the cells, and then the cells are excreted by the body itself. There's no downtime, there's no pain, only loss of fat. Now we follow that up with VelaShape 3, and make sure you look at VelaShape 3. That's the newest radio frequency to shrink the skin afterwards, because if you deflate the skin, i.e. with deflating by removing fat, the skin may hang a little bit. But with the VelaShape 3, it in combination goes ahead and tightens the skin. Now, we're going to move on to minimally invasive. And what's that? That's liposuction, basically. And we call it liposculpture. Why is that? Just removing fat isn't enough. We want to contour the body so the fat removed parallels the shape that we all want. Now, for isolated pockets of fat, liposculpture is the best way to go. It will remove that fat, and we can do this sometimes just under local if it's a small area, or we'll put you to sleep. And then through very small incisions that are hidden either in the pubic area or around the umbilicus, the tummy button, we'll put the cannula in and remove that fat. That's always usually done as an outpatient surgery. You would wear a binder afterwards, and people are usually back to work after 1 to 2 days. We also include VelaShape 3 afterwards because, again, we've debulked the fat, but the skin envelope may hang. So VelaShape 3 is always used with our liposuction. Now, for those abdomens that have had separation of the muscle, we call it diastasis recti, after pregnancy or massive weight loss, if you just liposuction, you'll still have the balloon. And why is that? Think of the abdominal wall as a balloon. Internal fat on our spleen, kidney, liver, stomach blows out that abdomen, as in pregnancy. So the two muscles that are usually together, called the six-pack muscles, separate. And sometimes after the pregnancy or weight loss, they never go back completely in the normal position. So liposuction or UltraShape will really not help that. That's where you need an abdominoplasty or a tummy tuck. And what we do with that is we make a small incision, as can be made, in the pubic hairline. We go up the abdominal wall, bring the muscles together, and then pull down the excess skin and fat like you would if you had a carpet cutter. Then with your tummy button, we save the same tummy button that your mom gave you. What we do is we encircle it like an apple core, bring the tissue down, and then bring it through. That's a classic abdominoplasty. A mini abdominoplasty leaves the umbilicus intact and just shifts the tissue down, and we go up and repair the muscle. An extended abdominoplasty extends the incision out to the hips, usually used for massive weight loss patients. And then for those patients that really have excess tissue, it's called the fleur-de-lis. And what we make is an external incision about midway up your abdomen, coming down, cutting it like an upside down T or Tesla sign, taking all that skin out and bringing it together. It brings the skin in this way and down. The only downside with this is there's a midline incision. But for those patients that desire a really tight waist, and especially in the massive weight loss patient, it is ideal. So, in summary, we have 3 different ways to approach abdominal contouring. One is non-invasive, UltraShape power with VelaShape. We have minimally invasive, which is liposuction to remove the fat, and VelaShape. And 3, we have minimal incision surgery, which would be the mini abdominoplasty, moving on to the classic abdominoplasty, moving on to the extended abdominoplasty, and then lastly the fleur-de-lis. Thank you for your time, and I hope to see you soon.